Ovarian cancer claims more lives each year than all other gynecological cancers combined. Yet public awareness of its symptoms remains alarmingly low. Only around 1 in 3 women receive a diagnosis in the earliest stages when treatment is most effective. The 2025 National Ovarian Cancer Audit highlights a stark reality. Thousands of women are only diagnosed after reaching emergency care. In England and Wales, nearly half of those diagnosed over the past 3 years first presented as emergency cases, a figure that Ovarian Cancer Action, the UK charity dedicated to improving outcomes for women with the disease, describes not simply as alarming, but as a national health crisis. My name's Victoria, and I spoke with Jo Stanford, Health Projects Manager and spokesperson for Ovarian Cancer Action, about why so many women continue to be diagnosed late. We explored the symptoms that should raise concern, what steps to take if something feels wrong, and how to push for answers if your concerns aren't being taken seriously. Jo also explained how Ovarian Cancer Action is working to change the landscape, offering practical resources, including their new Symptoms Checker tool, which takes just under a minute to complete and could make the difference between an early diagnosis and a late one. Thank you for joining me today, Jo. It's a pleasure to have you here to talk about the importance of recognising the signs of ovarian cancer and raising awareness about seeking help. My first question is about the new National Ovarian Cancer Audit Report, which reveals that almost half of women are only diagnosed after presenting at A&E. From your perspective, what does this tell us about awareness and diagnosis in the UK, and where do you see the biggest failings in the system?
So you're exactly right. The latest data from the National Ovarian Cancer Audit does actually show that over 40% of women are diagnosed with ovarian cancer. They're actually reaching crisis level before they're being taken seriously. So what that's saying to us is they're being dismissed and misdiagnosed until their symptoms have become so severe that they end up with an emergency admission, which is absolutely traumatic. There's lots of reasons behind this. It could be down to difficulties accessing care. I think we all know how tricky it is getting timely GP appointments at the moment, delays in primary or secondary care, but we also know that awareness is really, really poor. So 90% of women don't know the 4 main symptoms of ovarian cancer, and 1 in 4 mistakenly believe that a cervical smear test actually detects ovarian cancer, which it does not. And only 1 in 5 know that persistent bloating is a symptom of ovarian cancer. So a large World Ovarian Cancer Coalition study actually found that of women diagnosed, over 2/3 of women had either never heard of ovarian cancer or had heard of it but knew nothing about it. So why do we care about the emergency admissions, the stats that we were just mentioning? You can imagine it's extremely traumatic for patients. What we're saying is somebody has had symptoms that have been bothering them for months. They've gone back and forth for months, and they've got to the point where they are actually going to A&E because they are in so much pain and discomfort. But we also know that women who are admitted as emergency have worse cancer outcomes than women diagnosed via non-emergency routes. So the ovarian cancer audit feasibility pilot actually showed that women diagnosed through emergency presentation are 4 times more likely to die within 2 months of diagnosis than those diagnosed via the urgent suspected cancer referral system. So a really big thing to highlight here is there's no screening tool for ovarian cancer. Research like we do with Ovarian Cancer Action towards finding new biomarkers for early diagnosis is really important, but also awareness of signs and symptoms is absolutely vital. We did a piece of research and they found that when they asked women about what they'd go to the GP about, they're more likely to take their dog to the vet than they are to take themselves to the GP. And that's some of what we're trying to talk about with what we're doing in our awareness side of things, is making women realise we know how difficult it is to get a GP appointment. We know how difficult it is to get listened to, but please don't hang back because you think, oh, it's probably nothing. I think that's part of the issue as well as the awareness and, the issues down the system is empowering women to think that they actually should be going. It's not just a niggle. You matter. It's not just looking after the kids or your pets or your own parents. It's looking after yourself as well.
Ovarian cancer symptoms are often misinterpreted as IBS, menopause or stress. So, why are the early warning signs of ovarian cancer so frequently mistaken for other common health conditions?
There's a few elements to this. We have to acknowledge that the symptoms are really vague. They happen to women, happen to everybody all the time, really. There's a lot of crossover with symptoms of other less serious issues. So what we're not suggesting is that every time anyone experiences any of these symptoms that everybody should panic and assume it is cancer, because it's most likely not. And actually, if we look at the numbers of people being diagnosed, a GP is likely to only see maybe 2 cases in their whole career. So even if a GP has seen ovarian cancer before, it will have been years and years ago. So it's understandable that it's not the first thing in their mind. It's much more likely that it's something less serious and more common. But what we do hear from people is that rather than finding the cause of that vague symptom, quite often they're sent away and dismissed. And it's also worth noting that the Department for Health and Social Care study that they did found that 4 in 5 women actually report that they've experienced not being listened to by healthcare professionals. So that's a whole other issue that we're talking about. And there's so much that can be discussed there about, issues around how women's pain is viewed by healthcare professionals. But what we want to make sure people realise is that it's really important to acknowledge that we all know our own normal. We need to trust women to know that when there's something different in their body that's out of the ordinary, that they've not experienced before, if there's something niggling, we need to find the cause of it rather than dismissing it and assuming it's something minor. It should be in the back of a GP's head. We need to rule more serious things out. We know that women in the most common age group to be diagnosed with ovarian cancer, so that's over 50s, they're often a generation who are looking after the older generation and the younger generation. They'll be putting other people's needs ahead of their own. They're not going to be going to the GP about minor niggling symptoms like bloating and feeling full unless they're actually bothered by it, unless they know it's not normal for them and they're worried. And really that should be a red flag for a GP to investigate that. And there are actually clear guidelines through NICE about the tests to perform and when. And on the topic of IBS, a really important thing to note is lots of women are sent away and told it's probably IBS. If a woman is over the age of 50 and presenting for the first time with IBS symptoms, it's incredibly, incredibly unlikely to be IBS. IBS normally presents a lot younger than that. So that's a big red flag for any GP to be seeing in their practice. And menopause symptoms, menopause symptoms really cross over. And I think it's fantastic that more recently menopause has become into the spotlight. More people are talking about menopause, more people are becoming aware of it. But it's also really important not to assume that if someone's around perimenopause, menopausal age, that every symptom is put down to that. It may well be. We need to check it out. There are tests that are written into the NICE guidelines now, specifically about IBS, to kind of drill down and make sure that that's what we're looking at and to exclude other things, rather than it just be a case of your bowels have changed, go away and change your diet for a little bit. And, the woman goes away, not quite sure what to do with herself and doesn't solve the problem. Something that comes up quite often for us is people who are at high risk of cancer. So I don't know if you know much about BRCA mutations and hereditary cancer and things like that, but I carry BRCA mutation. You might have heard it from Angelina Jolie years ago when she talked about her surgeries that she had. I have had a double mastectomy to reduce my breast cancer risk, and I also had my ovaries removed when I was 36. So that obviously puts you straight into surgical menopause. And the guidelines state that you should be given HRT, right? Because you're replacing the hormones that your body would have had. But unfortunately, there's a lot of misinformation out there. So there's women having their ovaries removed at 35 and being told they can't have HRT because they have a family risk of breast and ovarian cancer, which is factually incorrect. But then that person goes through the hell of surgical menopause with no HRT. And then I've spoken to multiple women who 10 years later found out that that was wrong. So some of that is about educating GPs again, and also women themselves about the fear around HRT and how unfounded it is, and the data behind it, I think is a massive, massive issue across the board. One of the reasons we're keen on genetic testing is because it means people can take action to reduce their risk. But if you're then swapping that for awful quality of life and potential osteoporosis and cardiovascular disease down the line, it's not quite the balance that you think it is. There's so much misinformation about it. And obviously when I had my ovaries out in 2020 and I didn't really know anything about HRT and all of that, until leading up to that. And it actually makes me really angry because women are so dismissed. I know we're talking about women being dismissed, but there's so much health misinformation about things and misunderstandings even within the medical profession about what risk is and what increases risk and so on. And the problem is you've got an entire generation of women who were told that HRT is scary and are now getting to the age where they are going to be having osteoporosis and problems with their heart and all sorts of things that never needed to happen, So I think anything you can do kind of education wise around it is fabulous.
How can doctors take women's concerns more seriously, and how is Ovarian Cancer Action working to help women feel heard by their doctors?
We know that awareness of ovarian cancer symptoms can help more women present to their GP when they have these signs, and that means they get diagnosed earlier and receive the best available treatment and survive the disease for longer. So one of the main things we want to do is increase awareness of the symptoms and the red flags, and also make sure that women have all the information they might need and the reassurance that they are indeed right to see their GP. They're never, ever wasting anybody's time. So that's a really big message of ours. We want to empower women to advocate for themselves, offer tips on how to speak to the GP, what to take with you into your appointment, what to expect from initial investigations and what tests are done. And part of the reason why that's so important for people to know is it means that if that's not happening, then they can ask and say, are we going to do this test? If not, why not? What's going to happen next? And really give people the confidence to do that. And also to know what to do if they don't feel their symptoms are being properly investigated, what to do next. So alongside all of our detailed information about all of those topics, we've created a new symptoms checker tool to help women who are concerned navigate the next steps and be confident in taking action.
So could you take us through what the main symptoms of ovarian cancer are that women should be aware of, and at what point should they seek medical advice?
There are 4 main symptoms that I'll go into a little bit of detail about. So the first is persistent bloating. So I think we've all heard of bloating, but we don't want to assume that people know what that means when we say bloating. So it could be a feeling of fullness in your tummy that doesn't go away, uncomfortable tightness in your tummy or pain, your tummy feeling or looking bigger. Maybe your clothes feel a bit tighter. Your tummy might feel a bit harder than normal. You might find that your tummy is a bit bigger, but you've lost weight elsewhere, or a noticeable lump in your tummy. The next sign or symptom that we're talking about is difficulty eating or feeling full more quickly. And what we mean by that is you feel hungry, but you can't eat your normal size meal. You start eating and then really quickly think, oh, I'm full. So it might be that you eat or drink a small amount and then feel full. It could just be that you've noticed a loss of appetite compared to normal. It could be that you're experiencing heartburn or indigestion or nausea, feeling sick, being sick, or just constantly feeling like you've got an upset tummy. The next symptom we're talking about is needing to pee more often or more urgently. So it might be that you feel like you need to wee more often. It might be that you're rushing to the toilet, but you're not actually going very much, not passing much urine. It might be that you have a constant or frequent urge to wee, even when you haven't got anything in your bladder. And it might be, that you feel like you can't fully empty your bladder. And then the last one there is pain around your tummy. So when we say that, we mean kind of the middle bit of your body all the way down to the top of your thighs. Anything from a dull ache or pressure in your tummy that won't go away, sharp or stabbing pains in your pelvis, a heavy dragging sensation similar to period pain that comes and goes but keeps coming back, or pain during sex or when going to the toilet. There's also a few others that can also be signs or symptoms of ovarian cancer. That includes back pain, indigestion I mentioned, but that's one that people quite often comment on having, kind of a heartburn, indigestion feeling. Any abnormal postmenopausal vaginal bleeding is a red flag. And then unexplained weight loss and extreme tiredness as well. And if you're experiencing these regularly, they're new for you and they're persistent, any of those symptoms, you don't have to have them all. Please don't think you need to kind of tick off every one of them. Any of those symptoms, then you need to go and see your GP.
Ovarian Cancer Action has recently launched a new symptoms checker. Could you tell us how it works, how it can help women detect ovarian cancer earlier, and what steps should someone take if they feel worried about their results?
Our new symptoms checker is on the Ovarian Cancer Action website. That's where you can find it. What it is, it's a free, fast online tool. It asks you a couple of questions about whether you've experienced certain symptoms, and it's designed really to help you spot symptoms early. It helps recognize patterns within them and also helps you seek medical advice sooner. So it takes us a minute. And really the idea is to turn information into action, because we know women are accessing information about symptoms. We see the traffic on our website when we're doing awareness work, that the information is being accessed. But really, the next step is to encourage people to take action, because we know that women put their health below those of their family, their pets. And we do actually have a stat that says that 2/3 of women report they would act immediately if they found a lump in their breast, but less than a quarter would do the same if they experienced symptoms of ovarian cancer. So really, the idea of this is to bridge that gap between the information and getting people diagnosed. So this simple symptoms checker, the idea is to validate women's concerns if they're experiencing symptoms, and then to encourage them to act and nudge them to visit their GP. What do we also do with the symptoms checker is to offer information on what the next steps are, give people a bit of a nudge and help as to what to do next. We provide a downloadable symptoms diary to take to the GP to support the discussion in the appointment. And that really, really helps, because as we've discussed, these signs and symptoms are quite vague. It's quite difficult to go to a GP and say, I've been feeling bloated for a few months. If you go to the GP and you have a written down diary saying, I've experienced this 4 days out of 5 for the last 4 weeks. This has happened these days. These are the experience I've had. You feel like you have a piece of evidence in front of you. You feel a lot harder to be dismissed. It's also easy for the GP to spot what's going on, and really it helps the patient advocate for herself and provides a basis on what should be happening next. And really the idea then is that people are signposted to information about the whole process, as well as the general areas on our website that includes information about the disease and treatment if someone is later diagnosed, as well as where to find support. It's one thing, like I say, to get people the information, but how do we get them to then act on it? So if someone puts their email address in and agrees to, hear from us, then over time we will send a bit of a reminder. How's it going? Have you seen your GP? We know that there can be delays getting to see the GP. So in the meantime, filling in that diary makes it feel like you are doing something while you're waiting. It feels like by the time you go and see your GP, you've got that evidence in front of you. You know what you expect to happen. You feel a bit more empowered. You've got your tips about what to do. For example, taking somebody with you, having your list of questions. What questions should I ask? Asking about what tests are going to happen. Really helping empower that person to know what to do next and what should happen.
With survival rates up to 95% if ovarian cancer is caught early, how much difference could better awareness of symptoms make?
A woman has 95% chance of surviving 5 years if they're diagnosed at stage 1. If we compare that to stage 4, that survival rate's only 16%. We also know that recurrence rate is a lot lower with earlier stage, and you're more likely to have treatment with earlier stage, but less than a third of cases are actually diagnosed at stage 1 or 2. There's no screening tool for ovarian cancer, so early diagnosis completely depends on women presenting to primary care with symptoms at the earliest possible point. And something that's really important to mention is, for many years, and I'm sure many people listening or reading will remember this, is people called ovarian cancer the silent killer, which we don't do anymore, because actually I think that takes a lot of power away from the woman of being able to spot the signs and symptoms and act on it. But people think that symptoms awareness won't make much difference because of that. But actually, we now know that's not the case. So the World Ovarian Cancer Coalition did a study of women with the disease and found over 87% of women diagnosed at stage 1 experienced symptoms, and most of those reported to have experienced 4 symptoms. Another study found that 1 in 4 women diagnosed using symptoms-triggered testing had stage 1 or stage 2, so early stage ovarian cancer. And finding the cancer in these women early meant they had a much better chance of surviving than if they were diagnosed late. And even women who are diagnosed with later stage cancer benefited from the quicker testing, because most of them were able to have surgery that removed almost all of their tumours or all of their tumours. And even within those diagnosed at a later stage, shifting the diagnosis even slightly earlier impacts survival. So, for example, being diagnosed at stage 3A has a higher survival rate than stage 3C. So women also benefited if they were diagnosed later, as most of them were eligible for treatments that they wouldn't have been able to have being diagnosed even later. So that demonstrates really that symptoms can be present and spotted at the earlier stages of the disease. And so symptoms awareness can therefore translate into higher survival rates.
And finally, many women are reportedly dismissed when they raise symptoms with their doctor. In these situations, how can women keep pushing for answers, and how can Ovarian Cancer Action support them?
The really key message for us is about empowering women to know their own bodies, to be confident in saying this isn't normal for me, to get support from other people as well. One of the tips is to take somebody with you to a GP appointment, and things like that. Because I think we've all faced that where we're very confident going into an appointment and then we'll get white coat syndrome when we're sat in front of somebody. So having somebody there to help advocate for you, ask the questions that you're a bit worried about asking, and really ask for help. There is help out there. There are support organisations out there as well. But to keep asking, keep pushing. The unfortunate thing is when you're not feeling well, that takes a lot of energy. So the more support you can get around that from, friends and family and so on. But it's all too common that people are sent away, that are, dismissed. And that really is devastating for entire families. So I don't mind sharing the fact that that's exactly what happened in our family. So one of the reasons I work for Ovarian Cancer Action, and I'm so passionate about all of this, is that almost 20 years ago, we lost my mum to ovarian cancer. And it's exactly the situation. She went back and forth to the GP with constipation again and again and again, kept being sent away for months with laxatives, which didn't do anything. And it was only through pushing and my dad getting involved and my parents saying, well, what about this test, that she was eventually diagnosed with late stage ovarian cancer, but she passed away 3 years later. So that was 20 years ago. And this is still what's happening now. And we hear that, we've talked about people over the age of 50, but we really should make it clear as well that ovarian cancer affects all ages. It's just simply, the biggest number of people are over 50, but women are being diagnosed every year under that age. So everybody should know the signs and symptoms. Everyone should be sharing the signs and symptoms, learning the signs and symptoms, and also helping people they know. Years ago, I did an awareness talk and there was a gentleman in the audience and he said, I can go to sleep in this one. And actually, the key thing to note is it doesn't matter if you have ovaries. We all know, love, work with, are friends with women. And as we've discussed, women aren't very good at going to the doctor because we put everybody else ahead of us, especially when it's these niggly symptoms. So if you know or love or work with or, care at all about a woman, it might well be you saying, hold on a minute, you said you felt like that last week. Hold on a minute. The last 3 weeks you've said that you rush into the loo or, you can't finish your lunch. You really should get that checked out. And that little nudge from any of us looking after each other could be the bit that pushes someone to go, it isn't just in my head. Maybe I will fill in the symptoms check. I'll fill in the diary. Yeah, it is happening more often. I will go make an appointment. So we can all help each other as well. One big message would be to be aware of your body, know what's normal for you, and be loud. Never worry that you're wasting someone's time because you're not. So if you have any concerns at all, go to ovarian.org.uk. Use our symptoms checker, download our symptoms diary, keep a track of your symptoms, and remember that early action saves lives.